when we analyse the data, we're going to see a much greater mortality caused by this peak of prevalence of coronavirus.
Welcome back to Ask Dr. Hilary Coronavirus Explained. Now, I want to start off the show by talking about how COVID-19 itself kills people, because obviously for most people, symptoms are mild, or you might not even know you have the virus. So how does COVID-19 actually kill you?
Well, we have to remember that most people only get mild to moderate symptoms. Many people have no symptoms at all. That's important to remember, because we're all thinking of the worst case scenario at the moment, and we can get sort of a bit obsessed with that. However, for some people, they do get severe disease, and what happens is that the virus attacks the lungs predominantly, causing the lungs to become very congested and for the air sacs to fill with fluid, so that it's difficult for the body to get enough oxygen from the air that we breathe into the bloodstream. And that's the major problem. The lungs become quite stiff and fibrotic, which means that they kind of become scarred. Now, we know that if we push oxygen under pressure into the lungs, that really helps. And that's what a ventilator does, or a CPAP machine does. And we can keep people alive in the hope that they will produce antibodies that will protect them down the line. Now, on top of the breathing problems, that's because the lungs are stiff, it puts a strain on the heart. And people with weak heart muscles, people in heart failure, people who've had heart attacks, people with heart valve problems are more prone to complications because of this. We also know that people with liver disease, kidney disease are more prone to the dehydration that can occur. And it's in these ways that organ failure can result from severe infection with coronavirus.
Why does it kill people? I mean, there's obviously not many, but there are some people with no underlying health conditions, perfectly healthy people. Why does it still kill those people?
We believe that some people may have been exposed to something like a coronavirus in the past, and they have a kind of antibody enhancement, so that the previous exposure, like an allergy in a way, means that they have an overwhelming response to this particular virus. And the white blood cells in their system, which normally protect us against infection, release a storm of chemicals called cytokines, which cause too much inflammation. We all need a bit of inflammation to combat a virus, but if there's too much, it can be counterproductive, and we call this a cytokine storm. That is apparently what happened in the second wave of the Spanish flu, which killed a lot of young, fit, healthy people. And we believe something like that may be happening, antibody-dependent enhancement, ADE we call it, that may be happening in some of these young, fit people. It may also be that some of these young, fit people do have an underlying condition which wasn't previously diagnosed, just like some teenagers have a cardiomyopathy that was never diagnosed. So there are two possible explanations for this.
Let's move on to the people's questions. Now, the first question is from Caroline Lamont. She says, is there any reason some people only get mild coronavirus symptoms whilst others get it severely? Is it related to the amount of virus that you ingest, or is it down to how well your immune system copes with it?
Well, we'd like to think it was something to do with the immune system, but then none of us have had previous exposure to this coronavirus, so immunity is kind of irrelevant. But as we know in individuals, immune systems work in different ways. Young, healthy people can get allergies and anaphylaxis because their immune system is overreactive. It may be that it's the overreaction of an immune system in some people that causes the problems. We refer to that as a cytokine storm. In other people, it may be something to do with the amount of virus to which we're exposed. And that may be an explanation as to why people at the cutting edge of treating people with COVID-19, anaesthetists, people putting people on ventilators where there's aerosolization of the droplets from the patient, exposes them to such high amounts of virus that it overwhelms the immune system. So this is a virus that is puzzling in many ways. Do we want an overactive immune system, or do we want an immune system which isn't very strong? It may be that's why children are hardly affected by the virus, because their immune systems haven't yet developed properly. So there are some very interesting questions, and it'll take cleverer people than me to explain exactly what's going on here.
Question 2 is absolutely fascinating, really interesting question from Edward Hudson. Now, he says, on a daily basis, we hear about the number of people who have died from coronavirus. As a comparison, what was the daily national death rate before the coronavirus outbreak?
Yeah, the difference between those two things is called the excess death rate. Now, some statisticians and epidemiologists have sought to play down a bit the mortality that is being reported, saying, yes, but a lot of those people would have died anyway in the next year or so. They've got pre-existing conditions like angina and strokes and diabetes, and they would have died anyway. My argument is this, that it doesn't explain the higher number of young, fit, healthy people who are losing their lives. That certainly wouldn't be seen in a usual year. The figures that we're having reported about mortality don't include people in care homes in the community that are dying, having never been into hospital and tested for COVID-19. And one further thing is that all those people with pre-existing conditions who might have died in the next year might equally have had another 10, 15 years living with chronic heart failure or type 1 diabetes. The fact is that they might well not have died this year. It's the coronavirus that gave them an accelerated and premature death. And therefore, I kind of don't believe that we're seeing something akin to the normal death rate or the death rate that we'd see excess deaths from something like seasonal flu. I think this is, when we analyse the data, we're going to see a much greater mortality caused by this peak of prevalence of coronavirus.
So what does that gap look like at the moment then? Do we have any figures on that?
Well, I have seen some figures, but I don't think they're reliable. I've seen various figures bandied around. But for me, the excess death rate is very considerable, and I wouldn't like to put a figure on it because the figures are so open to interpretation.
Great. The next question is a video question from Stephen Myers.
Hi, Dr. Hillary. Are there different strains of COVID-19 that can be contracted? Thanks.
We believe we're dealing with one strain. I think the reason for the speculation is that because people tend to have such variable symptoms. Some people, no symptoms at all. Some people, mild symptoms, just like a cold or a sore throat. Other people who have very, very severe disease. And therefore, people are speculating that, maybe one's a mild form of coronavirus and the other is much more virulent. There's no evidence to think that we're dealing with two different strains at all. What we do know is that we're able to sequence the genome of the virus. In other words, look at its DNA. And there's nothing to suggest that the DNA that we're seeing in all the people that have got the disease is different to any other to the virus that started off in Wuhan. We think it's the same one.
The next question is from Lindsay Poulter. Now, she asks, I understand that NHS staff must be tested for the virus, but what about all the other key workers? I work in a large food production factory and I'm at risk of catching the virus. When can we, as key workers, be tested?
As soon as we have capacity, you'll be tested. And by means of the capacity, what I'm saying there is that we just simply don't have enough tests, so we have to prioritise those people who are most at risk. And undoubtedly, the people at most at risk after the patients who are admitted with respiratory problems are the key healthcare workers who are face to face with patients who've got proven disease. Other key workers, of course, need to be protected. They should have PPE, personal protective equipment. And they will be tested down the line when we have enough tests. But of course, they're not exposed to the same level of risk as healthcare workers, and therefore they're a bit lower in the hierarchy. But my God, they're doing a great job. Everybody appreciates what they're doing. They need to be careful. They need to practice their distancing from other people. I hope they're wearing protective gear, and eventually we'll get them tested.
Now, the next question is from Sharon. She asks, how long do symptoms of the virus last? Now, this question is interesting because Boris Johnson, for example, had the virus, but he's had it over a period of more than a week. So how long do they last, the symptoms?
Again, it's very variable. Some people don't have any symptoms at all. Some people have mild symptoms lasting 3 or 4 days. Some people, like Boris Johnson, will have a temperature for 10 days or more and feel quite tired and still have a cough 3 weeks later. I know of people who really haven't picked up after a month, but are slowly recovering. So I think the answer to that is it's variable. It depends on how the body deals with the virus, how quickly it eradicates the virus from their bodies. So it's difficult to say. By and large, on average, people are better within the 14 days of self-isolating after they begin their period of self-isolation. And we think that people can shed the virus for probably up to 5-6 days after feeling completely well again, even if they've got a dry cough and nothing else. So the answer is it's variable.
Great. The next question is from Gail. She says, having previously suffered from pneumonia, am I at high risk of contracting COVID-19 and my lungs not holding out?
Most people who get pneumonia will make a full recovery, but it can depend. If the pneumonia was very severe and there's any damage to the lungs, permanent damage, then clearly there would be a predisposition to be a bit more susceptible. However, as I say, many people get a pneumonia which completely resolves and you'd be no more at risk than anybody else of the consequences of COVID-19.
The next question is from Terry Pawsey. Now they ask, can a breastfeeding mother who contracts the virus pass it on to a newborn baby?
The current evidence is that if you want to breastfeed and you've had the virus, you've been exposed to the virus, you can continue to breastfeed. There's no evidence that the virus is transmitted in breast milk, just as there's very little evidence at all that the virus can be vertically transmitted from the expectant mother to the unborn baby. However, the recommendation is that if the mother is well and breastfeeding, she should avoid breathing over the baby as the baby is breastfeeding to reduce the risk. But there's very little evidence that babies and infants are very much at risk of the virus at all.
Fantastic. Thank you so much, Dr. Hillary. Now, if you want to ask a question, go onto social media and use the hashtag AskDrHillary, or you can go to the Sun's website. We have a page, thesun.co.uk/Dr. Hillary, or you can go to Talk Radio's website at talkradio.co.uk.